Well, good morning and welcome back to CityLine. Yep, he's in the house. I am talking about the new CEO of Pierce County AIDS Foundation. Please join me in welcoming the lovely Ace Robinson. How are you, my friend?
I'm doing well. Thank you so much for having me.
It's great to have you here. I feel like I've been angling to have you on this show for a long time. So it's like, he's here. And look at the shoes you have on. We're going to do some shoe cam. Let's see if we can get, Cheryl's going to, okay, hold them up. Ta-da!
Oh, sorry. Where am I going here?
There.
Over here? There we go. And
of
course, we have to have the other side.
Rainbow on the back.
Yes, you have to have the full size.
The full meal deal.
Yes.
These are the shoes for the brand new CEO at PCAF to wear. Let's talk about how long have you been in this position and where did you come from?
So I've been serving as the proud CEO of PCAF for about 3 months now.
Yeah.
I'm most recently coming from Long Beach, California, and this is my third time in the Pacific Northwest. I actually began my career in HIV care, doing vaccine design up at Fred Hutch when I was working in West Africa. And then I came back again and served another HIV service organization in the Seattle area.
Wow. And as you say, just so casually, in West Africa, you know. So we are a few years into the ending the HIV epidemic. Tell us more about that.
So in 2013 and 14, I was the principal architect of something called the End AIDS Washington State Initiative. So really what we were doing, we were trying to align the planets to make sure that we do what is necessary to end the HIV epidemic and associated illnesses. So that included things like making sure the politicians were understanding where the money needed to go, making sure that the organizations were being intentional in serving those communities that were still being disproportionately impacted by HIV, and coming up with like a system and an initiative that included everyone, and it made that mean that we all had the opportunity to lean in to really get this done.
Yes.
Right? Because like we have all of the tools. Like today, we don't need a cure, we don't need a vaccine. We have all the tools to end this epidemic right now. But we have to align our resources, we have to align our thoughts, we have to align our energies to make this all happen.
So my brain is like spinning because what is it about HIV that brings together both sides on the political aisle? Because that's what we're dealing with, is that political paralysis of not being able to come together and say yes to the solution.
Yeah, when I think about where we are with the epidemic from when we first identified it in 1981. There was a clear understanding this was about everybody. This wasn't about the people over here or the people over there. And when we think about like the stories of American politics, when it comes to something like HIV, we're talking about all people leaning in and doing this work. The two biggest federal programs related to HIV, one called PEPFAR that came from George W. Bush, and domestically, the Ending the HIV Epidemic Initiative, which we're currently working on, that's coming from the previous president to President Biden, I can't remember his name sometimes.
I can't either.
Right, sometimes it just goes out of my mind.
That's right.
Right.
Right. So as the architect of End AIDS Washington State Initiative from 2014, how is it going and how are things going in Washington State?
Good and bad.
Tell me.
This is like more of the serious part of the conversation. In reality, for certain communities, we have accomplished what we needed to do. What we have seen from like the data, because data doesn't lie. We can talk about feelings, we can talk about anything that's off from the reality of the conversation, that the data will show you how well you're doing, how poorly you're doing. So what we've seen is that predominantly Black, Indigenous, Native Hawaiian individuals are not benefiting from all of what we have available to us. Because remember I said we have the tools?
Yes.
Some people don't have access to those tools yet. And so we're seeing HIV acquisition. And then the worst part, HIV mortality still existing. And we're in a country that honestly isn't doing the best when it comes to HIV. Like, you know, how we judge things around HIV, this is like healthcare talk. If someone's living with HIV and they get on treatment, then it becomes impossible for them to pass on the virus to someone else, A. But then also, if someone's living with HIV and they get on treatment, then it's also that they'll live a longer and healthier life. So complete product placement, forgive me.
That's all right.
I'm wearing a shirt.
Yes, here it is.
Yes. It says U equals U. So it's about facts over fear. So if you remember, well, not you, you're younger. So in the 80s,
I'm older than you.
So in the 80s, there's so much stigma around HIV.
Yeah.
So much stigma.
Silence equals death.
Yes, exactly. And it's still true.
Yep, it is.
And people who are living with HIV often feel like vectors to society, meaning like they feel like they're the scourge of society because society made you feel like that even before you knew your diagnosis, right? And so with U equals U, what does that mean? Undetectable equals untransmittable, meaning that if someone is able to take their medication who's living with HIV and they take it and so like the virus goes down, becomes undetectable, it becomes impossible to pass the virus on to someone through sexual behavior. And what we know, like, you know, what are we talking about? We're talking about sex here.
Yeah,
We're talking
we are.
about drugs here. We're talking about how people enjoy their lives. And we want to make sure that people can enjoy their lives without coming to us for treatment or trying to navigate the world because we want you to be able to focus on so many other things. Like what is your thing? Your thing is social justice and you're concerned about LGBTQ health or rights. You're concerned about sexual reproductive health. Maybe you're concerned about the environment. Whatever your thing is, do your thing. We don't want to worry about things like related to sex and pleasure because we want that to be the fun part of your life, not the negative part of your life.
Exactly. Wow. So you mentioned that things were not going well in our state. Where is it going well that we could learn from?
So back in 2013 and 14, we worked on something called PrEP-DAP. So PrEP, there is actually a medication. I never want to assume knowledge. There's a medication that is available that can prevent HIV acquisition if you take it. Right. Okay. So like you're out, you're having a good time, but you have an exposure to HIV. It actually makes it nearly impossible to acquire HIV if you're taking that medication. Washington State created the gold standard to that called PrEP-DAP, Drug Assistance Program, making sure that no matter if you're rich, poor, whatever, you have access to this medication. Well, like on the side, every year we have this thing called World HIV AIDS
Yes,
Day,
that
December
thing.
1st.
Yes.
We received a note 2 days ago to honor World HIV Day. They're going to eliminate the program in Washington State. Meaning, remember what we were talking about,
Yes.
because this isn't just about LGBTQ justice. This is also a race justice, sex justice conversation. Those communities that were disproportionately impacted by HIV will no longer have a tool. We're going to remove a tool away from individuals who often are poor, do not have the best health care, do not have access to all kinds of health care access. And so what are we going to do with those individuals?
Ace, we're going backwards.
Yes. And then also, I'm so glad for the previous presenters, like speaking about what they're doing, from food is medicine, housing is health. When we start having these conversations, what's also happening in Washington State is that there's this idea that we're going to remove. This is policy wonk stuff. They're going to remove a program that allows HIV service organizations to receive some money from people getting their medication. Because going into the wonky side, you take your meds, there's a carve out in our health policy that makes sure that those organizations that specifically serve those populations that we're talking about will no longer get that money. So that's what we're scared of. Washington State is making the national news, unfortunately, for going backwards in its HIV response as opposed to going forward.
Who do I need to talk to?
Everybody, to be some of our politicians have been absolutely amazing and supportive. Speaker Lori Jenkins has been great, right? County Council member Ryan Mello has been phenomenal. Same thing with Senator Jay Peterson. There's some individuals who have been leading the way on the policy side, and then we have to work with our folks in the health department and our folks at the healthcare authority to make sure they're doing the right thing.
My goodness. In this last minute and a half here, this is a big question. How close are we to a vaccine and a cure?
This is the part that's exciting. I recently just came back from an HIV conference, and that was the big piece. Because when you come back from these conferences, of course, the first question is, okay, is there a cure? Do we have a vaccine coming? And the answer is, we are getting so much closer. Now, this isn't like COVID, where there was so much studies and so much study and research done prior to identifying. HIV was brand new in 1981. So we're trying to build a plane while it's flying. And what we're seeing is that the people on vaccine, treatment, and cure are working together, because what we're seeing is some of the success in part A is helping with part B, which is helping with part C.
Yes.
And I think, and I'll say within our lifetimes, so like I say within 30 to 40 years, we're going to be there. Hopefully sooner, but definitely within 30 to 40 years.
Okay, when you look back on your time at PCAF, what do you want to be known for?
Creating a gold standard so that the people who have been stepped over and mistreated for the last couple of thousand years have a place to come where they know that they're not just welcome, they're invited. Being invited is where we're trying to go. And we have to change that and make the healthcare system work for everybody. And we'll start with PCAF and go beyond, because it's not going to just be us. It's going to take everyone.
Exactly. We have many more dates on this comfy couch to have, my friend.
Thank you.
So thank you so much for being here today. You're
Great.
Amazing. That wraps up another great segment of CityLine. It's always a pleasure and a privilege to be in your home. We've given you some great things to think about in this past hour, so please go out there, be a part of the tapestry, and above all, pay it forward. And when you come back, as always, we'll be waiting for you right here at CityLine. Take care.
Common as my home, yeah, to common as my home. Right, you're from the east end. How you're from Green Bay. How you're from Atlanta, but the common's where you'll stay. Right, you're from the east end. How you're from Green Bay. How you're from Atlanta, but the common's where you'll stay. Yeah, Tacoma, that's my home. From the pines to the dawn. Tacoma, that's my home, yeah. Tacoma, that's my home. Tacoma, that's my home. Place I call my own. Tacoma, that's my home, yeah. Tacoma, that's my home. All right, you're from the East Coast. All right, you're from the West. All right, you're from the middle, but Tacoma's still the best. All right, you're from the East Coast. All right, you're from the West. All right, you're from the middle, but Tacoma's still the best. Hey, Tacoma, that's my home. From the pines to the dawn. Tacoma, that's my home. Yeah, Tacoma, that's my home. Tacoma, that's my home. Place I call my own. Tacoma, that's my home. Yeah, Tacoma, that's my home. Tacoma, that's my home. From the pines to the dawn. Tacoma,